That's a very unique study that we are doing at MD Anderson, adding regulatory T cells to Ruxolitinib in patients with myelofibrosis and suboptimal response. So there has been a lot of data that the inflammatory pathway play a very significant role in these patients not having ideal responses as well as disease progression. So the Tregs therapy has been tried in patients with acquired bone marrow failure syndromes, but also included in an early phase study few patients with myelofibrosis with very promising and triggering responses. Therefore, we created a new compound called CK0804, which is, or 0804, sorry, which is CXCR4-enriched Tregs. They are given as a cryopreserved product, multiple doses with no HLA matching to patients on Ruxolitinib that would have measurable disease, which is defined as a suboptimal response. This patient gets 6 infusions every month, IV, in ambulatory setting outpatient, and the dose is fixed at 100 million cells per dose. And then we basically, because it's a first study, measured safety, but then there are exploratory and secondary endpoints for early efficacy as well as immune analysis. So at the ASH, I'm presenting completed safety run-in cohort of 9 patients that was mandated to show safety for this study. And then we have enrolled all of these 9 patients. MD Anderson Cancer Center enrolled 8 of these 9 patients, and 1 patient was enrolled from Albert Einstein College of Medicine. And then what we have seen was perfectly safety results were not concerning whatsoever. We have given 49 infusions with 1 infusion reaction to the cell preservant DMSO in 1 patient. Otherwise, we had no other cells-related hematologic or non-hematologic adverse events. So that was quite successful. And then we looked at the preliminary efficacy where we have noticed every patient had improvements in some symptoms. 6 out of these 9 patients had TSS 50, which is considered a standard response for symptom assessment. And then we have seen also spleen volume reduction and improvements in early satiety that was statistically significant. What we have also seen was statistically significant of fatigue that improved towards the end of the study that was along with the early satiety data. So we also did a quite extensive analysis of cytokines throughout the whole study prior to each infusion as well as end of therapy. And there were very unique patterns of inflammatory cytokines, Tregs, chemoattractants. They were upregulated, downregulated, or fluctuating, but mostly there was an excellent correlation between responders and upregulation of anti-inflammatory cytokines. So there's something that's going on and very exciting. Currently, the study is expanding to the next phase, which is going to explore a little bit more intense dosing. 1 infusion monthly times 4, and then every month what we have been doing so far because of the fluctuation and understanding how better we can modulate this immune system. So we were quite excited about this, and we're looking forward to the next data.